Stroke warning signs and essential tips for prevention. Hello, welcome to my channel and another health video. Imagine you're going about your daily routine and you feel perfectly fine. But beneath the surface, a storm may be brewing in your brain. Yes, stroke. A sudden interruption of blood flow to a part of the brain can occur without warning. However, the good news is that, in many cases, your body may send subtle warning signs weeks or even months before a big event. Let's explore the world of stroke and the early signs that empower you to take action and potentially prevent a more severe event. Warning signs of a stroke. One beautiful morning you are making coffee when suddenly you feel a strange tingling sensation in your right arm. It's faint and fades as quickly as it appears. You ignore it and attribute it to sleeping on your arm wrong. But over the next few days, the tingling comes back, sometimes accompanied by a brief moment of dizziness. Maybe it's just a little bit of stress, you reason. A week later, you are engrossed in a conversation with a friend. Your speech sounds slurred as if your tongue is a little heavy. Your friend doesn't realize it, but discomfort sparks inside you. Finally, one morning, you wake up with a headache for no particular reason. Unlike any headache you've experienced before, it's intense and unrelenting. You try to get rid of it, but at the same time you have blurred vision, and you are struggling to maintain your balance. Fear grips you. Could something more serious be going on? These seemingly insignificant experiences can actually be your body's way of warning you of a potential stroke. Recognizing these early symptoms and seeing a doctor immediately can make a world of difference in preventing a significant stroke and its devastating consequences. Let's first list the warning signs of a stroke 1 month before it happens in a clear and numbered list. Frequent and severe headaches. These headaches are often severe and may be accompanied by dizziness or visual disturbances. Research shows that such headaches can be related to vascular problems in the brain before a stroke occurs. Intermittent numbness or weakness. Sudden numbness or weakness affects one side of your face, arm or leg and may feel like tingling, weakness, or even paralysis. The American Stroke Association notes that transient ischemic attacks (TIAs) are severe warning signs that should never be ignored. Difficulty speaking. Aphasia. Struggling to find the right words, slurred speech, or even complete loss of speech can be a red flag that the brain's language centers are affected. This symptom often precedes a stroke, and early detection is essential. Vision problems. Sudden vision changes, including blurring or loss of vision in one or both eyes, which can be intermittent and cause temporary vision problems, are warning signs. These symptoms may be due to reduced blood flow to the eyes or brain. Loss of balance and coordination. Feeling unsteady on your feet or experiencing unexplained dizziness, especially when accompanied by other symptoms, can be a warning sign that there is a disorder in the areas of the brain responsible for controlling movement. Understanding these symptoms and responding promptly by seeing a doctor can significantly improve the prognosis. Early intervention, lifestyle adjustments, and medical treatments can reduce the risk of stroke. Studies published in the New England Journal of Medicine show that timely intervention in stroke cases and treatment, as soon as possible, significantly reduces the likelihood of experiencing long-term complications. Now, let's review the practical steps to prevent a stroke after seeing the early warning signs. Healthy diet. A heart-healthy diet, such as the DASH and Mediterranean diet, emphasizes fruits, vegetables, whole grains, fish, olive oil, and nuts. These diets are associated with a reduced risk of stroke due to their anti-inflammatory and heart protective properties. Focus on healthy fats, such as those found in olive oil and fish, while limiting saturated and trans fats. Limit salt and sugar. Reducing salt intake helps manage blood pressure, while reducing sugar intake lowers the risk of diabetes, two important factors in stroke prevention. Instead of relying on salt, use fresh herbs and spices to flavor your meals. Cinnamon, honey, and other natural sweeteners are healthy alternatives that can improve overall health. Take care of your potassium intake. Potassium helps regulate blood pressure by counteracting the effects of sodium. Studies show that including potassium-rich foods such as bananas, avocados, and leafy greens can be very beneficial. Management of blood pressure and cholesterol. Regular use of prescribed medications and consistent monitoring of blood pressure and cholesterol levels are critical for stroke prevention. But it's also important to emphasize the importance of lifestyle changes alongside medications. Quit smoking. Enrolling in smoking cessation programs can provide support and resources to help you quit smoking and significantly reduce your risk of stroke. Consider using nicotine replacement therapies (NRT), such as patches, gum, or lozenges, which can help manage withdrawal symptoms. Smoking not only increases the risk of stroke, but is also known to cause many diseases, including cancer. Stress reduction. Prolonged stress leads to the continuous release of stress hormones such as cortisol and adrenaline, which can disrupt the immune system, increase blood pressure, and promote inflammation. Chronic stress is linked to a higher risk of cardiovascular diseases, including heart attacks and strokes. Mindfulness and meditation exercises can help reduce stress levels and improve mental health. Yoga, deep breathing exercises, and hobbies can help manage stress effectively. Regular physical activity. Regular physical activity is a hero in the fight against stroke. Aim for at least 150 minutes of moderate or 75 minutes of vigorous intensity exercise per week. Even small activities throughout the day can make a difference. Aerobic exercises such as walking, swimming, and cycling improve cardiovascular health and help maintain a healthy weight. Strength or resistance exercises such as weightlifting and squats build muscle, improve metabolism, and support overall body health. Limit alcohol consumption. Keep alcohol consumption within the recommended limits of no more than 2 drinks per day for men, and no more than 1 drink per day for women to reduce the risk of stroke. Healthy and non-alcoholic alternatives such as herbal teas and water are good options. Maintaining a healthy weight. Maintaining a healthy weight is vital for reducing the risk of stroke, as excess body weight, especially abdominal fat, increases the strain on the cardiovascular system. This strain can lead to conditions such as high blood pressure, type 2 diabetes, and high cholesterol, which are major risk factors for stroke. Excess belly fat contributes to atherosclerosis, plaque buildup in the arteries, which can block blood flow to the brain and cause ischemic strokes. Stay hydrated. Proper hydration plays an important role in reducing the risk of stroke. Dehydration can cause the blood to thicken and increase the chance of clot formation, which can block blood flow to the brain and cause an ischemic stroke. Additionally, dehydration can lead to high blood pressure, which is a significant risk factor for stroke. Staying hydrated helps maintain optimal blood viscosity, promotes healthy blood pressure levels, and ensures that the body's metabolic processes function efficiently. Aim for about 8 glasses of water daily, but individual needs may vary based on activity level and climate. If you know other stroke symptoms, leave a comment. Thanks for watching, and if you enjoyed this video, don't forget to subscribe for more health tips and information.